Right now I'm going to talk about the care and maintenance of a compound light microscope, which is a very common microscope to have in a veterinary clinic. It's what we use to look at fecal samples, cytologies, so it's important to keep them in good condition, important to take care of them well. So first of all, you are going to make sure that anytime you're cleaning it, you have a professionally formulated cleaner that you're going to use, and high quality lens paper to clean the lenses. So when you're cleaning the ocular lenses and you notice that there's some debris when you're looking at a sample under the scope, a good way to check and see if the debris is actually on the ocular lens is to twist the ocular lens and see if the debris moves. If it does, usually it means that the debris is actually on the lens. So you're going to use your lens cleaner and your lens paper. You can gently clean the lenses. Other things to keep in mind, location of the microscope. You want it to be in a place where it's not going to be exposed to excessive heat, splashing, the jarring vibrations of a centrifuge, also where it's not going to get moved very often. If it does need to be moved, it needs to be carried with 2 hands very carefully. When you're rotating the objective lenses, you never want to rotate using the lens itself. You always want to rotate using the nose piece here. You want to make sure that when it's not being used, it's always kept with the lowest magnification here in case the stage gets coarsely adjusted high up. It's not going to crack the lens. Other things to keep in mind when you're changing the light bulb in the microscope, you want to make sure it's the exact same bulb that was in there before. You don't want to touch it directly because the oils from your fingers can damage the bulb. Brand new microscopes need to be calibrated using a stage micrometer, and that usually only needs to be done once in the life of the microscope, but they should be professionally serviced at least once a year. Also keep the light off when it's not in use, and always keep a dust cover on the microscope when it's not in use to avoid any dust getting in there and damaging it. So now that I've gotten the sample that I need to run the Snap ELISA test, this is a 40x snap test. It's going to test for heartworms, it's going to test for 3 other tick-borne illnesses, anaplasmosis, Ehrlichia, and Lyme disease. So what I need to do first, there's a conjugate that comes with the snap test. So for this specific test, we do 4 drops of conjugate. And I'm going to add 3 drops of the heparinized blood from the sample from the patient. So 3, okay. And then I'm going to invert this to make sure that they're mixed. Once they're mixed, I'm going to pour this into the snap test. I'm going to wait until the blood enters this dot at the bottom, and then I'm gonna snap the test. It's gonna incubate for 8 minutes, and then we will check the results. So now that it's been 8 minutes, we can see the results of the heartworm test that we just ran, the 40x. So as you can see on the heartworm test here, the only dot that's visible is the control dot in the upper right-hand corner. The fact that none of the other dots reacted with the mixture of the blood and the conjugate means that it didn't detect any antigens for heartworms, Ehrlichia, anaplasmosis, or Lyme disease, so that's great news, and therefore we know that this dog is negative for all 4 of those diseases. The reason we do the modified knots test is to distinguish different kinds of microfilaria. So Dirofilaria and Acanthochylanema filaria look very similar, but they have some minor differences. So in order to see them microscopically, we do this test. So I have 2% formalin here that I've created using tap water and 10% formalin. So I'm going to use 9 mils of this in this conical centrifuge to So I have 9 mils there. I've got a mil of blood from a heartworm positive dog that I'm going to add here. So now I'm going to invert this, make sure it's adequately mixed. I'm going to let it incubate at room temperature for 2 minutes, and then I'm going to centrifuge it at 1500 RPMs for 5 minutes to create a pellet at the bottom. So now I have centrifuged the formalin and blood mixture for 5 minutes. As you can see, there's a small pellet in the bottom. So that's what we're going to be looking at under the microscope to look for microfilaria. So what I'm going to do is I'm going to pour off this super neat, being careful not to disturb the pellet at the bottom. Okay, now I'm going to add 1 drop of new methylene blue stain. Okay, and then I'm going to use, I don't have a pipette long enough, so I put an 18 gauge needle onto this syringe, and I'm going to use that to stir up this pellet and the stain, and then I'm going to get some off of the bottom. Okay, so I have that drawn up into my syringe. Now I've got a clean slide and a clean cover slip here. I have to get a new cover slip, but I'm going to put 1 drop of the stained mixture onto the slide with a cover slip. Okay, so now I'm going to look at this under the microscope, and what I'm looking for are the fixed microfilaria and the differences between the Dirofilaria and the Acanthocylonema. So the Dirofilaria, which are the heartworm filaria, and I'm going to look at this under 10 and 40. The differences are that the heartworm filaria, the Dirofilaria, are a little bit longer, a little bit thicker. They have a conical head and straight tails. So as long as your microscope is calibrated correctly, you'll be able to tell with the micrometer the length and width of the filaria. And these are indeed Dirofilaria immitis, which is heartworms. So I have a stool sample here, and I'm going to be showing how to perform a direct smear. We do direct smears to view parasite eggs under the microscope, but using a direct smear you can also see protozoa that you may not see on a float, such as Giardia or Coccidia. So what we're going to do is just take this little wooden stick. You do not need very much stool at all, just a little tiny bit, because it's going to be a very thin suspension of the stool. Let me get rid of that. And some saline. So equal amounts of stool and saline, just a drop. And I'm going to be mixing, I don't think that got on there. There we go. I'm going to be mixing this together. Again, want to make a very thin suspension that we can see through under the cover slip. Okay. So now I'm going to put the cover slip on top so that I can view it under the microscope. Alright, so I'm going to come over to the microscope, set it on the stage here. Oh goodness. Okay, turn on the microscope. So I'm going to focus under the 4x power. Also want to make sure that our condenser is, we want the highest contrast possible. So I'm going to focus initially under 4x, but to view a fecal smear, we're going to look under either the 10x or the 40x. And that's going to show us under the 40x, which is the high dry power, is where we're going to be able to view bacteria and protozoa. So I don't see anything out of the ordinary. I'm seeing an even balance of coccygean rods with about normal amount of motility. This dog isn't, the dog that we took the sample from isn't having any symptoms as far as runny stool or anything like that.
Perfect.
So it doesn't surprise me that I'm not seeing any parasite eggs or protozoa. Okay, so now I'm going to demonstrate how to do a few different kinds of fecal tests. We've already done the direct smear method, so now I'm going to show simple fecal flotation, a centrifugation with fecal flotation, and then a sedimentation. So I have 3 different fecal samples here, as you can see. So I'm going to add some, this was Fecasol is the brand of mixture that we use to do the fecal samples here. A little stick here, sometimes it helps. But I'm going to mix the fecal samples of each of these with a small amount of the fecal solution, fecal float solution. Mix it really well. Okay, so this is going to be our sample for the simple fecal float. And I'm going to take a piece of gauze and I'm going to strain it through the gauze into this cup. Of course, you want to be wearing gloves for this. And that's going to get rid of the majority of our sediment, but the eggs should still make it through. Okay, now what I'm going to do is I'm going to pour this solution that's been strained into this vial here. Now I'm going to fill up the rest of this fecal solution here to form a little bubble on top, which is the meniscus. So now I'm going to take a clean cover slip, and that's going to sit on top of the meniscus. I'm going to let that sit for about 20 minutes. And then at the end of that time period, we'll come back and I'll be able to look at that microscopically. So that's our simple fecal flow. Okay, so we're back. It has been about 15 minutes. So this simple float should be ready to read under the slide. So you're going to take the cover slip off the top, and most of the parasite eggs should have floated to the top at this point. So what we can do is put it under the microscope. Of course, we are going to focus on beginning at the lowest power, 4, but then we're going to look at it under the 10 power. So you want to scan the whole slide from one corner all the way over. And basically you're looking for roundworms, whipworms, hookworms. It's rare that we'll see tapeworms on this float. We possibly may see some coccidia, but I'm not seeing any parasites on this float per se. So now I'm going to talk about the centrifugation method of fecal testing. So I have another fecal sample here. Again, I'm going to mix it with a small amount of fecal solution. Mix it up real well in here. Grab a wood stick to get it out of the fecal loop. Okay. And yes, mix it up really well. So now I'm going to strain it through a piece of gauze into a clean cup. Get rid of the majority of the debris. Okay. Now for this method, I'm going to pour this fecal solution into another vial, except this time I'm going to fill it up to the top with fecal solution to form a meniscus.
You want me to give her a pickup time or just tell her we'll call her?
Again.
Okay.
And now I'm going to use a clean cover slip to place on top of the meniscus. Oh geez. Put that a little more. Okay. So clean cover slip on the meniscus here. Get rid of some of that extra. But this is what I'm going to centrifuge with the cover slip on. And I'm going to centrifuge it between 400 and 650 Gs for 5 minutes, and that's going to cause the eggs, any parasite eggs, to float to the top. And then afterward, we'll take a sample from the top of the solution and look at that microscopically. Okay, so now we've finished centrifuging our centrifugation fecal sample. So now we are going to look at it under the microscope. So I'm taking the slide from the centrifugation tube. Look at the microscope here. Again, we're looking for parasite eggs, roundworms, hookworms, whipworms, coccidia. So generally you're going to look under the 10 times magnification for this. And again, you're going to scan the whole slide looking for parasite eggs. But I'm also going to set up the sedimentation float. So for that, and again, we start the same way with the fecal float solution. Going to mix it up really well. Again, we're going to strain it, get the majority of the sediment out of there. And this method is used primarily to see fluke eggs, which tend not to show up on the floats because they're too heavy. So now for this one, put this in another vial. Gonna add a little more fecal solution, and then we're just gonna let this, you can either centrifuge it and use the pellet at the bottom for the sedimentation, or you can just let it sit undisturbed for 20 to 30 minutes. We're just gonna let this sit undisturbed for 20 to 30 minutes. And then we'll come back to it, and once the sediment accumulates on the bottom, we'll use a sample from that to look at it microscopically. Now for the sedimentation method, we've let this sit here undisturbed for 30 minutes. So what I'm going to do is I'm going to pour off the supernatant, and what's left at the bottom, I'm going to use this 1 ml syringe with an 18 gauge needle to draw up samples from the bottom, the middle, and the top, because different parasite eggs have different weights and are going to float at different depths. So I've got a clean slide here. So I'll take one from the very bottom first. I'm gonna put a drop on a slide. Okay. Now from the middle. That in the middle. And then one from the top. Okay, so now I can look at each of these. Need a clean cover slip for each of them. Okay, so we've got our 3 samples here on this slide, and again I'm gonna focus under the 10 times for each of them, looking for parasite eggs. And depending on what I find, I would notate whether or not the animal is positive or negative for parasites and which ones. So I'm going to show how to collect a midstream urine sample free catch method. This is Riker, little puppy. We're going to do a urinalysis on him. So important things to remember when you're doing a free catch urine collection. You want to try to do it early in the morning. That is when it's most concentrated and less likely that there are dietary agents in the system that are going to affect the chemistry of the blood. So when I take him out there, I'm going to make sure to wait after he's begun to urinate. I don't want to get the initial stream because that is the most contaminated since it's coming directly from the body. I'm going to wait till midstream so that it's less contaminated. So I'm going to take him outside now. We're going to collect this. You ready, buddy? Hey, come on. Okay, so I'm going to wait for him to go. Wait for midstream catch. And there we go, we've got our urine sample free catch. So we're going to be doing a cystocentesis to get a urine sample from Isabella here. We have her in dorsal recumbency. You can also do it in lateral recumbency. The reason we do this is to get a sterile urine sample for either culture or sensitivity testing. So we have two people restraining. Nichelle here is going to palpate for a bladder and also use the ultrasound machine. Oh, it's okay. It's okay. She's going to use a 1 to 1.5 inch needle on a 10 ml syringe. It's going to be a 21 to 22 gauge needle. She's going to find Isabella's umbilicus and go directly caudal to that and direct the needle dorsocaudally once she palpates the bladder. It's okay. It's okay. You're so scared. You're so scared. It's all right. And then once she is in the bladder, she's going to apply gentle negative pressure through the syringe to aspirate some urine. And once it's collected, we'll put it into a tube that we can send out for culture. Can you see it, Savannah? Alright, and that's how you collect urine through cystocentesis. So I'm going to demonstrate how to do a urinary catheter on a dog. The reason you do this is to take a sample that you can use for sensitivity testing, you can use for bacteriological culture, because it's going to be more sterile than a free catch method. So right now we have our subject here. He is sedated. He'll be neutered after this. Dr. Blake here is going to extrude the penis by pushing the penis cranially and the prepuce caudally. Okay. Now I'm going to clean the tip of the penis with some antiseptic. We're using betadine here. And then I'm going to use sterile saline here to rinse it. So I'm going to put sterile gloves on first. Sterile gloves for me, thank you. Michelle, would you mind opening that catheter for me? So we're going to use a red rubber catheter here since this is a one-time collection. Now I'm going to put sterile lube on this catheter. It's a new bottle. Michelle's going to open it for me. We'll take a strip from the center just to ensure that it's sterile. Put the tip of the catheter in the lube here. And then I'm going to advance the catheter through his urethra. And the goal is to get it into the bladder. So now, Michelle, would you mind opening this syringe for me and just taking off the needle there? I'm going to use this to obtain some, the first few milliliters of urine we're going to discard. Because this will be, in case there's any contamination from the catheter. There we go. We're just going to discard this into here. This is the non-sterile. Now what we get from here should be more sterile. And we can use this for our culture and sensitivity testing. Put this into a clean, sterile tube, and we'll submit this for your analysis. And that's how you collect a urinary sample by catheter. All right, so now I'm going to be doing a sample collection from the ears of this dog. Her name is Danny. She's had some yellow waxy debris in her ears in the past, has been treated with Claro, but she still has swelling in her ears. So I'm going to get samples from each of her ears, and then I'll proceed to staining those and looking at them under a microscope. So Shelby's going to restrain her for me. We'll start with her left ear. Have a sterile swab here, just going to go down into the canal a little bit. Get enough of a sample here. I'm sorry, baby girl. Good girl. I know it's painful. All right, I will snap this one so I know that that's the left ear. Good girl. Now I'll get a sample from the right ear. Good girl, baby. I'm sorry, I know it doesn't feel good. Okay, and that's how you get samples from their ears. Now that we've gotten the swabs from Danny's ears, the samples from each of her ears, I'm going to prepare them on a glass slide so that we can read them underneath the microscope. So I have a clean glass slide here that I've labeled with her name. I'm going to take the left ear first. I like to draw the letter L. That way, if anybody else picks up the slide, there's no mistaking which ear it's from. Take the right one and draw an R on the right side of the slide, making sure I get plenty of the sample
Such a small amount that
on the slide.
It's like shocking to me. Like,
So now I'm going to heat fix the slide using a match.
A brand new baby.
This is going to
A brand new baby.
cause the sample to stick to the slide.
Thank you.
Just wipe off any of the black from the matches. Okay, and now I'm going to use a fixative.
Oh, I'm so sorry.
And the two stains for the ears. So I'm going to stick this in here for 30 seconds. seconds.
Yes. Can we tell her second?
And then the final stain for another 10 seconds. Now I'm going to rinse off the excess in the sink here on the back of the slide, so as not to rinse off the sample itself, just the excess stain.
I was smiling about it because I know they didn't, but
Dry off the back of the slide. Careful not to touch the front where the sample is. And then I'm going to let it air dry. And then we'll come back and read the slide under the microscope after it's finished drying. Alright, so now that our sample has dried on the slide, we're going to read it underneath the microscope. Turn the microscope on. We've got it under the lowest power 4 right now, which is what I'm going to use to focus initially. Just put the slide on here. Get it centered on the stage. Find my sample. Okay, I'm going to look at the left ear first. Use the fine adjustment knob to get it focused. Okay, stage is up. Alrighty, so now I'm going to go to the power of 10. It's a little bright. Okay. Alrighty. So now I'm going to go to the high dry power. Focus it. Alright, so now that I've got it focused there, what I can do to look under the high wet power, I'm going to go between the dry and the wet. Excuse me, I'm going to grab this oil here. So I've got my immersion oil. I'm just going to put a very tiny drop underneath the lens. Now I can move over to the high wet power. Focus. Alright, so I am seeing in the left ear some yeast. I would say 2+ yeast and some rare cocci. So I will report those findings to the doctor and we'll continue with treatment in the left ear based on those findings. I would read the slide for the right ear the same way. So I'm gonna do a fungal culture from Jack here. He's got some suspicious areas on his belly here. So in the veterinary clinical setting, the majority of the significant fungi that we deal with are from the dermatophyte category, and so 98% of the ones of those that affect cats are from the Microsporum canis species, and then 50 to 70% of dogs are affected by that. So in order to take a sample from a suspicious lesion, which are often circular and flaky, you're going to take either a clean toothbrush, which you can scrape the lesion for 1 to 2 minutes to collect enough sample on the toothbrush, or you can take some sterile hemostats, which I'm going to use today and I just opened. So first you're going to clean the lesion with some alcohol just to get rid of any surface contamination. And I've got some dermatophyte testing medium here, which is where we'll put the sample once I collect it. I'm gonna go ahead and open that. So when you collect the sample, you just wanna look for broken hairs and scales around the edge, the periphery of the lesion. That's gonna be your the most likely to have some of the fungi on it, if that's what you're getting. So I'm just taking a little bit from there. Okay, and I've got some, you can see. Now, once I collect that, I'm going to put it into the dermatophyte testing medium. You want to press it below the surface, slightly. Okay, make sure it's in there below the surface. And then I'm gonna put the cap on loosely. We're gonna let that incubate at room temperature. And we're gonna check on it for growth over the next few days. If it turns red, that means there is evidence of the dermatophytes, and so then we would do a wet prep of that and look at it under the microscope. So we'll come back in a few days, see if we have any growth, and then do the wet prep. Okay, so it's been a couple days. This is Jack's DTM sample that we're checking for dermatophytes. Don't see any red color change, which generally means it's negative for dermatophytes, but for the sake of this video, we're gonna show how to stain to look at the sample microscopically. So I have some cellophane tape here that I'm gonna insert and get some of the sample on. And then I'm going to use this lactophenol cotton blue. Just put a small drop on here to stain it. Okay. Making sure not to get my fingers anywhere near the sample itself. Okay. There we go. And the tape serves as a cover slip. So now I can come over here to the microscope. I'm going to look at this under the power of 10. And what I'm looking for are gonna seem like cigar-shaped fungi with lines going across them. And that would be our dermatophytes, which unsurprisingly I'm not seeing since we didn't have any color change to red indicating that we would see them. So I'm going to perform a skin scrape on our friend over here. She's got some suspicious lesions on her skin. We want to get a microscopic examination of those. So there's two different kinds of scrapes. You can do a deep scrape or a superficial scrape. The deep scrapes are going to be for your sarcoptic and Demodex mange, the mites that tunnel or get deeper into the skin. You can do a superficial scrape for surface dwelling mites. We're more concerned with the deeper dwelling mites, so we're going to do one of those today. So I'm going to use a number 10 blade. I'm going to dull it a little bit on my glass slide here, and then I'm going to put a drop of mineral oil on my slide and on my blade. I'm going to hold the blade perpendicular to the surface that I'm scraping. And for a deep scrape, I'm going to get in between the affected and the affected areas. And I do want to draw a little bit of capillary blood because that's going to show us that we're getting deep enough down into the tissue. But you need to be careful not to cut the patient with your blade. So you just want a little bit of capillary blood oozing. Okay, I'm seeing a little bit of blood there. So I'm gonna go to a different spot. You just want a couple spots. Okay, getting a little bit of blood there. So now I'm going to take the skin cells and the hair that I've collected. I'm going to deposit them into the oil here. And then I'm going to take a clean cover slip. And I'm going to, I'm doing a video, guys. And I'm going to put a cover slip on here. And then I'm going to go look at this microscopically. Okay, so now I'm looking at our skin scrape sample underneath the low power magnification of our microscope here. Looking for Sarcoptes or Demodex mites, which I am not seeing any of those. So this is probably not a mite infestation. It's probably some other kind of infection or atopy. So we'll have to do a little further research to figure out what's wrong with her. Alright, so Dr. Blake is doing a necropsy on this feeder rat that was previously frozen. I'm going to assist her getting samples.
Central midline incision.
You can zoom in.
Okay, we're in the abdomen. Here's the liver.
Can you see? She's looking at.
This organ right here. There's intestines. Into the colon and the cecum, which is large in a rat. Down to the spleen. I'll remove the spleen. Spleen looks grossly normal. Here's the kidney. Way down in here. See if I can remove that. It's grossly normal externally. Cut through the middle to look internally. And looks like it's normal ratio, cortex to medulla. Remove the other kidney. Which is much more kind of tight up in there compared to the left kidney, which is very normal. Okay.
Alright, so each of the samples were placed in 10% formalin. I'll label this Pinky Pinkerton, today's date. This is going to be the spleen. I'll label this the left kidney and the right kidney. And we'll get those shipped off properly for histopathology. Let's talk about rabies. So rabies is a universally fatal virus. The most common reservoirs for this virus in the US are bats, skunks, foxes, and raccoons. Clinical symptoms vary for those animals affected by rabies. They usually begin with a fever, hind limb ataxia, and hyperesthesia. Then as the brain and the brainstem become affected by the virus, This progresses to neurological symptoms. Usually the animal only has 3 to 10 days after neurological symptoms set in before death occurs. Pets should be vaccinated yearly. Vaccinated pets with exposure to a rabid animal must be promptly revaccinated and then observed for 90 days. Any animals that have exposure to rabies and they were not vaccinated prior to that, they should not receive a revaccination and they should be monitored for 6 months. Any humans who have occupational exposure to livestock or wildlife should receive a series of prophylactic rabies vaccines. Any humans who will need to handle potentially rabid animal, they should protect themselves with disposable outerwear, protective eyewear, gloves. Hands should be washed, and the people should avoid any contact with the suspected animal's saliva or cerebrospinal fluid. There is no antemortem test for the virus. The animal is tested post-mortem. They do a fluorescent antibody stain of the brain tissue. There has to be a list kept of anybody who had possible exposure to a rabid animal, and those people must be contacted between 24 and 48 hours after the test result of the suspected animal is confirmed. So I'm going to be performing a vaginal swab to do a vaginal cytology. This is Rosie. She has previously been in heat. She's actually been standing for dogs within the last 2 weeks, so we're going to determine the stage of estrus that she is at. So what I've got here is some sterile saline. I'm going to have Dr. Gordon here just hold her tail up, and I'm going to gently rinse her vulva with some sterile saline. And then I've got a sterile cotton tip swab here that I'm going to moisten. And I'm going to initially insert this into the vulvar opening at more than a 45-degree angle until I reach the top of the vestibule. Now that I've reached that, I'm going to move the swab parallel to the floor and gently slide it forward. Okay, and I rotated it to get some cells. And I'm going to use these cells. I'm going to make 3 lines, roll it across this clean slide here. You don't want to press too hard because you don't want to damage the cells. So now I'm going to go fix this in some methanol and then stain it. Alright, so I've got Rosie's slide with her cytological smear here. So now I'm going to fix it using a methanol-based fixative. So I'm going to slide it in here for 30 seconds. Okay, so now I'm going to dip it into the red stain for 10 seconds. I'm going to dip it into the violet stain for another 10 seconds. Great. I'm going to rinse the back of the slide so I don't rinse off our sample. Just get the excess stain off of there. Now I'm going to allow this to air dry. So now that Rosie's slide has completed air drying after being fixed and stained, I'm going to look at it under the microscope to determine what kind of cells we see, and depending on that will give us an indication of what stage of the estrus cycle she's in. So I'm going to turn on my microscope. Focus under the lowest power first, progressively moving up. Okay, I'm going to look at it under 40x power. And I'm looking for epithelial cells. Okay, so I am seeing epithelial cells They're intermediate epithelial cells, parabasal and basal, rounded edges with parent cytoplasm, and the nuclei are very visible. And I'm looking for either red blood cells or leukocytes. I'm not seeing them, which makes sense because based on what the owners told us about her history, it sounds like she was in estrus about 2 weeks ago. And it usually lasts an average of 9 days up to 15 days. So she's probably in estrus at this point, which makes sense because you're going to see a lot of epithelial cells with a lack of red blood cells and leukocytes under the microscope. I'm going to do a brief discussion of the 4 stages of the estrus cycle of a canine. So we'll begin with a discussion of anestrus. During this stage of the estrus cycle, which lasts 4 to 5 months or more, a dog is not going to show really any behavioral signs. There won't be any vulvar swelling. She will not attract male dogs. She won't be attracted to them. Cytologically, you're going to see nucleated epithelial cells that vary in size from basal to parabasal to intermediate. There may be some numbers of neutrophils, but there shouldn't be any red blood cells. So following anestrus, also known as diestrus, the female dog is going to move into proestrus, which lasts anywhere from 4 to 13 days, on average 9 days. It can be divided into early and late proestrus. So during this time, the female dog's vulva is going to swell up and she's going to have a reddish or pinkish discharge. She's going to attract male dogs, but she won't permit them to mate with her. Cytologically, the epithelial cells are going to be basal or parabasal. There's going to be a large number of red blood cells with few to no white blood cells. During the late proestrus, the red blood cell count will decrease. There may be the appearance of some white blood cells. So after proestrus, the female dog is going to enter heat or estrus, which also lasts between 4 to 13 days, on average 9 days. So during this time, the vulva will remain swollen and the discharge is going to change to a straw or whitish color. At this time, male dogs will be attracted to her and she will also permit them to mate with her. So cytologically, there's going to be very few red blood cells, no white blood cells, and the epithelial cells are all at this point going to be non-nucleated and they're going to be cornified. So towards the end of estrus, white blood cells will increase, the red blood cells will start to disappear, and the female dog is going to enter the last stage of the estrus cycle, known as metastrus, which is the stage that our vaginal cytology subject Rosie was in when we did her cytological smear. So this stage lasts 2 to 3 months, and at this time the vulvar swelling will decrease. Again, she will not be attracted to male dogs won't be attracted to her. Cytologically, the epithelial cells are going to return to being non-cornified and they will be nucleated. There will be a lot of debris visible. There will be small numbers of neutrophils, but there won't be any red blood cells again. Cytologically, metastrus is very similar looking to anestrus or diestrus, and it is indistinguishable from pregnancy. Now I'm going to talk about doing a manual cross match between 2 animals for a blood transfusion to make sure that they're compatible. So you have a donor and a recipient. You need blood samples from each of them. You want to keep everything clearly labeled with the donor and recipient's name so none of the samples get mixed up during this process. So our donor is going to be Sarah today. Our recipient is Charlie. I got blood samples from each of them. You divide each dog's blood sample between a lavender top tube and a serum separator tube. And now we're going to centrifuge these down as you would regular blood. And then we're going to decant off the serum from the serum separator tubes into clearly labeled red top tubes, one for Sarah and one for Charlie. So I'm going to centrifuge these down for about 10 minutes, and I'll come back to you for the decanting process. So I finished centrifuging both canine blood samples. Now I'm going to take the serum from each serum separator tube, and I'm going to decant it off into a clearly labeled plain red top tube for each of them. So this is our donor serum from Sarah. Okay. I'm going to do the same for Charlie, who's going to be our recipient. Decant off his serum into his own labeled red top tube. Okay, now the next step is to have a clearly labeled glass tube, one for the donor, one for the recipient, and you're going to decant off the plasma from the centrifuged lavender top tube, because you want to get down to the packed red blood cells at the bottom. And then we're going to take 2 drops of those red blood cells, and we're going to put them into that clean glass tube. So this is for our donor, Sarah. So there's 1 drop, 2 drops. And then we're going to take, for each of them, we're going to add sterile saline to the tube with the red blood cells. We're going to invert that, make sure that the red blood cells and the saline are mixed well. Okay, now I'm going to do the same thing for our recipient, Charlie. I'm going to decant off the serum. Then I'm going to take 2 drops of his, there's 2 drops of his red blood cells, and mix them with sterile saline, just like we did for the donor. Again, I'm going to invert that so that it's mixed. And then I'm going to take both of these and I'm going to centrifuge them for a minute at 3,400 RPMs, and I'll come back. Now that the centrifugation is done, you can see the supernatant is clear. So the purpose of this is to rinse the red blood cells. So this is Charlie, the recipient's saline and red blood cells. So we're going to decant off this saline to get down to the red blood cells. And essentially, we're going to rinse both dogs' red blood cells a total of 3 times. So this is the first time. So now we're down to the red blood cells. I'm going to add some more saline. Prepare our second rinse. Recap it. Invert. Put it back in the centrifuge. Now we're going to do the same thing for our donor. Supernatant is clear, red blood cells are getting adequately rinsed. So now we're gonna add some more saline for this rinse. Invert. All right, so now both of them are going back in the centrifuge for another minute at 3,400 RPMs. This is our second rinse. So we'll come back and we'll do it one more time after this. So we've spun down the second rinse. This is Charlie's. Again, just gonna decant off the saline. Okay, gonna add saline one more time. I'm gonna get them good and rinsed. Okay, invert. Okay, we'll put this back in the centrifuge. Do the same for our donor Sarah's blood. So now saline to this one for our final rinse. So now we're gonna centrifuge one last time, 1 minute, 3,400 RPMs. So the final rinses have completed. So for the last time, supernatant is still clear, which means that they've been rinsed really well. This is Sarah, the donor's red blood cells. So we're gonna decant this saline off one last time. So now we've got our rinsed red blood cells, and this is donor, this is Sarah. So I have a clean glass tube labeled for Sarah, and we're gonna make a red blood cell suspension with these rinsed red blood cells from her blood sample. I have a syringe here with 0.98 mils of saline drawn up. So we're gonna drop 0.02 red blood cells and add that to this clear tube to create a suspension that we're going to use for our cross match for the recipient. Now we're going to do the same thing for this is the donor. Yes. So we're going to do the same thing for Charlie, the recipient. So decant off his saline from his red blood cells. Very clear, looks good. Now we have our recipients rinsed red blood cells. I have another syringe of 0.98 mils of saline. Again, we're going to take 0.02 mils of the red blood cells. And put them into a clean labeled glass tube, and this is going to be our suspension for our recipient, Charlie. So now that we have our serum from each the donor and the recipient, and then the red blood cell suspension with the rinsed red blood cells from both the donor and the recipient, now we're ready to do our major and minor cross matches. So we have a new tube labeled for the major cross match. The major cross match is going to be 2 drops of the recipient serum and 2 drops of the donor red blood cell suspension. So that's going to be 2 drops of Charlie's 2 drops of Charlie's serum with 2 drops of Sarah's suspension. So this is Charlie's serum, the recipient serum.
She's thinking that. Okay. Okay.
And then I'm going to get 2 drops of our donor's red blood cell suspension, which is Sarah's.
Not the mask. Okay. Right, that's gonna irritate the.
Okay, so again, this is our major cross match. I'm going to invert it to make sure it's mixed up.
Blocking his airway.
Now for the minor cross match,
About affecting his eating.
it's going to be 2 drops of the donor's serum and 2 drops of the recipient's red blood cells. So we have Sarah's serum here. I'm going to do 2 drops of her serum. 1, 2. And then 2 drops of Charlie's, who's the recipient's blood cell suspension. I'll invert that. And again, this is our minor cross match. So, in order to be sure that everything was set up correctly, we need to create controls as well. So for the recipient control tube, we're going to put 2 drops of the recipient serum and 2 drops of the recipient's red blood cells together. So both of those will come from Charlie. So again, we're going to take Charlie's serum.
Okay. Gotcha.
And then 2 drops of his own red blood cells for our recipient control tube. Now for the donor control tube, we're going to take 2 drops of the donor serum and 2 drops of the donor's red blood cells. So 1, 2 drops of the donor serum. Mix that with 2 drops of the donor's red blood cells. So now we have 4 tubes. We have our major and minor cross match and our control tubes. So we're going to let these 4 incubate for 30 minutes at room temperature before we centrifuge these. Okay, we're back. So it's been 30 minutes and our 4 tubes, our 2 control tubes and our major and minor cross match have incubated at room temperature for 30 minutes. So now I'm going to centrifuge all 4 of these tubes for a minute at 3,400 RPMs and I'll come back. Okay, so now that our tubes have all centrifuged down, we are going to examine each of them macroscopically first for hemolysis. So first we have both of our control tubes, and as you can see the supernatants are clear on both of these, which is good because that means that the rest of the test is valid. So now let's look at our major and minor cross match. So this is our major cross match. There is a very slight amount of hemolysis. I did disturb the pellet a little bit, the red blood cells that are collected down there. So I don't believe this is enough hemolysis on macroscopic examination to indicate agglutination, but that's why we're going to take a drop on a clean slide and look at it under the low power microscope to make sure we don't see any evidence of agglutination microscopically. So now let's examine the minor cross match. Okay, here's our minor cross match, and the supernatant looks really clear in this one. So macroscopically, no evidence of agglutination. We're going to look at these major and minor cross matches under the microscope. So I've got a clean pipette. This is our major. Stir it up a little bit here. Get 1 drop. I'm going to put this on a clean microscope slide. So major is on the left. I'm going to do the same thing, the minor cross match.
Go.
So I've got clean cover slips here. I'm gonna put over our drops of blood. And now I'm gonna go over to the microscope and I'm going to examine each of these under low magnification. And what I'm looking for is evidence of agglutination. That's going to look like clusters. The red blood cells, instead of being evenly dispersed, they'll be clustered like grapes. This is, if I see that under the microscope, that's going to indicate that they are not compatible for a cross match. So I'm going to start with the major cross match, and we want to make sure the contrast is high. And for this major cross match, these red blood cells all look very evenly dispersed. I'm not seeing any evidence of clusters, so agglutination. So everything looks good based on that slide. As far as compatibility, look at my minor cross match. Same thing, even dispersion of red blood cells, no sign of agglutination. So both of these indicate that Sarah and Charlie are positive matches for a blood transfusion.